Fibrinolysis for patients with intermediate risk pulmonary embolism. Definition. For annoying with an acute pulmonary embolism, your prompt diagnosis and treatment can save a life in patients with high risk. P8 and sign of hemodynamic compromise. Fibrinolysis is an establishing its clear choice that can reduce pulmonary artery resistance, prevent recurrence, and reduce mortality.
Quiescent, very silent, very black. This is called Westermarck sign. It's a very specific sign for pulmonary embolism.
Application in medicine. Out of the cases of pulmonary embolism in the United States are diagnosed in the emergency department and wards as the second most common cause of sudden unexpected death in the occupation by is typically broken down into three major categories: massive hemodynamic compromise with an systolic blood pressure of
MOSCOSOs come from the lower extremities above the knee. So they're in the legs above the knee. That's where we need to start looking for these things. So, well, what is the pathophysiology? The pathophysiology specifically is that these blood clots form down in the legs because of something like factor 5
advantage: reduce the risk of death, prevent hemodynamic decompensation. Disadvantages: ischemic or hemorrhagic stroke, extracranial major bleeding.
Okay, well, welcome to another MedCram lecture. We're going to talk about pulmonary embolism and the treatment for it. Please refer to parts 1 through 3 in terms of the diagnosis and the clinical aspects. We're going to talk about treatment in this lecture, and with that, let's get started. Really, the cornerstone of treatment for pulmonary embolism is anticoagulation. There's a couple of ways of blood thinning.
This says, in patients with intermediate risk pulmonary embolism, fibrinolysis therapy prevented hemodynamic decompensation but increased the risk of major hemorrhage and stroke.